tell you about a patient of mine named James, who's 27 years old and has had a history of some serious substance abuse problems. Now, James was diagnosed with ADHD in elementary school, and around middle school decided he didn't want to take medications anymore. Beginning in late middle school and early high school, he started experimenting with marijuana and alcohol, eventually began to use other substances like cocaine, and finally, by the time he was finishing high school and he barely graduated, James was using prescription opiates. After high school, he worked for a few years as a janitor, but this addiction to OxyContin got the better of him. He finally was in an accident, got a DUI, and was court mandated for treatment. And they discovered that he not only had an alcohol abuse problem, he also had marijuana and opiate addiction. For this, he was given the diagnosis of polysubstance abuse and was started in an outpatient treatment in our facility. So James was started on Suboxone to help him withdraw from opiates, and he was also started on citalopram because he was complaining of depression. And he was able to maintain sobriety, but he had a real tough time concentrating, getting simple things done. He wasn't completing simple tasks around the house. He tried to go back to work and found it very difficult to stay focused on his job duties, and was reprimanded for coming in late. And so as a result, we then were asked to consult with him, and lo and behold, we realized that even though he was being treated for addiction, he still had the ADHD that plagued him as a child. So we added oros methylphenidate, and we began having him come for weekly cognitive behavioral therapy sessions in which he relearned what ADHD really is for someone his age, and where we began to help him overcome some of his negative attitudes about learning routines and doing things that required mental effort. Now, James had dreams, wanted to do something with his life, but had always avoided them and had turned to substances to help him with things that made him anxious, like social relationships. As time went on, James began to talk about wanting to start his own business. And lo and behold, he was able to get started in this business. He sells collectibles online, and over the last few months, he's been so successful that he's actually hired an assistant. And what James likes to say now is that he wished that he had continued his treatment for ADHD. Maybe he would have avoided substance use disorder, but he takes it all in stride. He's got a wonderful attitude, feels very positive about his life, and actually has offered to go and talk to some of the other patients in the recovery program to help them realize that some of them may in fact have ADHD that they ought to get treated. So I bring up the story of James in order to get you to think about the fact that maybe some of your patients who are in your office with other problems like substance use or alcoholism, or people who can't quit smoking, maybe some of them have ADHD underlying all of their difficulties, and it would be worthwhile for you to learn how to assess them and maybe begin them in treatment, because it could make a huge difference to their lives.